Okay, let's study a very important topic today, nephrotic versus nephritic, in which I'm gonna give you a very simple trick to remember the clinical features of both. So let's get started. If you have also done your MBBS from China, then you might be aware of this trick. This is a Thankyou ET trick, which our pathology teacher used to teach us. So Thankyou ET means three things are higher side and one thing is on the lower side. So what is higher is fluid, which is causing basically edema. Okay, the another thing is proteinuria. Protein is going more in the urine, which is more than 3.5 m per day. Then the third thing is lipiduria. Lipid is also going out in urine. The one E thing, like the one thing which is low, is nothing else. The one thing that is low is nothing but albumin, so it will be hypoalbuminemia. We are done with our nephrotic syndrome. Let's move on to the next, nephritic syndrome. In nephritic syndrome, I want you to remember poha. Okay, the poha chai we eat, that poha only. P is for proteinuria. There will be proteinuria as well, but not as high as in we see in nephrotic syndrome. So it will be about 1 to 2 gram per day. Whereas in nephrotic, what we were having, it's more than 3.5 grams per day. Then it's oliguria. Okay, then H will stand for two things. Basically it will be hypertension and hematuria, right? And A is basically casts are seen in nephritic syndrome. Learning the basic characteristics of both the syndromes, let's go on to the most common examples which is seen in different age group population, which I have divided into children, adult and elderly. So most common nephrotic syndrome in children is minimal change disease, MCD. Most common nephrotic syndrome in adults is FSGM, focal segmental glomerulosclerosis. Then most common in elderly, what we see is membranous nephropathy, so M. Now the same thing we'll do for nephritic. Children में most common nephritic syndrome will be post-streptococcal glomerulonephritis, so it will be PSGN. Most common adult का problem nephritic syndrome में will be IgA nephropathy. Okay, and elderly में ऐसा कुछ खास दिया नहीं हुआ है कहीं पे भी, तो you can just leave it. So this is the thing, this is the small chart you'll end up with, which is very high yield, very important and very basic as well, but कभी-कभी confusion हो जाता है. Nephritic, sometimes you get confused, so just remember Thankyou ET and poha, and the examples are easier as well. Thank you so much for watching. Please let me know in the comment section if you want to know some other high yield stuff, high yield table which we can practice before your FMG exam on December, and I'll try to make and upload it. Thank you.